doctors are set up to fail. It's really difficult.
From your perspective, I'd love to hear a little bit more like your general consensus of everything that's going on right now with the craziness of healthcare.
Is your podcast G-rated?
No. Say what you want. It's unfiltered.
It's a real shit show. Uh,
Yeah.
it's been challenging. As I said, my dad's a doctor, and he actually retired from medicine when I was 19. And he sold his practice. And fast forward to where we are now, and it seems like private equity has definitely jumped into much of the medical world. And a physician practice is not owned by private equity, it's owned by an insurance company. And it's very difficult because there are so many administrative burdens put on medical practices. It's very difficult to navigate.
Yeah.
Doctors are set up to fail. There are
Yeah.
so many changes and so many nuances, and it's such a maze. It's really difficult. And on top of that, we have fee for service, or there are risk models. There are so many different ways to get paid, but you're still getting pennies compared to what you got in the past. So in 2000, there was a massive change in the physician fee schedule and reimbursement for Medicare or from Medicare. And most of our insurance contracts are based on Medicare allowable. So the percentage of Medicare allowable. In my area in South Florida, Medicare tends to be the highest payer or one of the highest payers. And then you have all of these Medicare disadvantage plans that are out there. It's very difficult. I can't call them Medicare Advantage plans, but Medicare disadvantage plans. But the reimbursement in 2000 compared to what's going on in 2024, literally, you have to see 40% more patients
Wow.
to earn the same now as you would have earned in 2000. The physician fee schedule has not kept up with inflation, has not kept up with cost of living, has kept up with nothing. It's actually below. And the American Medical Association has a great graph. They update it every single year, but it lets you know Part A, which are hospital services, Part B, physician services, Part C, Medicare Disadvantage plans, and Part D, prescription coverage. So based on all of that, and then you have home health, which is a little different. Every single area has kept up or exceeded inflation other than the physician fee schedule.
Yeah. It makes it extremely difficult. And I found from my experience, so we work with a lot of private practices, and it puts them at a huge disadvantage when it comes to not only just revenue in general, right? And billing, but hiring, trying to find people that understand the back end operations to why they're getting paid less than if they went to some huge healthcare system, right? Where they've got multiple departments, where there's an overflow on money to where they can move things around when it comes to hiring people and having those budgets. Private practices don't have that luxury, and you have to be able to see a return on what that provider is billing, whether they're a PA or an NP or a physician. And there's a disconnect and a misunderstanding about, oh, well, I need to be paid, $180,000 because of inflation. And it's like, well, great. Then you have to see X amount of patients per day, right? So like that has to attribute to some way of what you're actually billing and making the practice. Otherwise, the practice can't stay afloat. And I think it's a huge issue with not only the education within programs not teaching them this, but also just like you're saying, the insurance companies really ruling private practice to where they have no choice. And it puts them in a really difficult position to where the people who are impacted are the patients, because it's just see as many people as you possibly can.